Hello, I'm Dr. Garrett Pullman, board certified urologist. Here are 3 things I would do as a urologist to reduce my risk for having a kidney stone. And if you've not passed a kidney stone yet, it's definitely not an experience you want to go through. And for those that have already had a kidney stone, have a 50% risk of having another kidney stone within 10 years. So the first thing I would do to decrease my risk for forming a kidney stone is try to limit my salt intake. This one is actually a surprise to most people. Too much salt or sodium in your diet can increase your risk for kidney stones, as dietary salt is linked to urinary calcium excretion. If you use salt with cooking, definitely don't add any additional salt at the table. Do not eat more than 2,300 milligrams of salt per day. So you really have to pay attention to labels to figure out how much sodium you're taking in. Items like French fries, chips, peanuts, and processed foods can have a high salt content with them. Now, the second thing I would do as a urologist to reduce my risk for having a kidney stone is increasing my fluid intake. It is recommended to drink at least 2.5 liters of fluid per day, which is almost 85 ounces, and water is preferable. It can be helpful to pick up a water jug that has the markings on the side so you can keep track of how much you're drinking in a day. And the third thing I would do is to have moderate calcium intake in my diet. As many kidney stones are calcium-based stones, many patients automatically think that they should be restricting the amount of calcium in their diet. Well, not only can too much calcium in the diet increase your risk for kidney stones, but calcium intake which is too low can also increase your risk. One potential mechanism for this is that lower calcium intake results in insufficient calcium to bind to dietary oxalate in the gut, thereby increasing oxalate absorption and urinary oxalate excretion. So the appropriate amount of daily calcium intake is defined as 1,000 to 1,200 milligrams per day for most individuals, which is associated with a reduced risk of kidney stone formation. Hope this helps.